Hello, for my RHS 100th exploration project, I decided to look into alexithymia and the various conditions related to it. What we will cover today is, first and foremost, what is alexithymia, as it is a relatively new condition with the term being coined in the early 1970s. Next, we'll look at what are the various causes of alexithymia. These are going to be more of genetic and environmental factors, as there is no known cause. What are some common linked conditions? Alexithymia is linked with a lot of other disabilities, and it's possible that there is a link between many of them. Next, if someone has this disability, or what I consider a disability, we're going to look at possible coping options. And we're going to look at should it be considered a disability, which I personally believe it should. Finally, we'll look at some advocacy covering alexithymia. So, what is alexithymia? The word alexithymia roughly translates from Greek roots into no words for emotions. And that's basically what this condition is. Alexithymia is a condition in which some people have trouble identifying their own emotions and or the emotions of others. People with this condition can often get emotions confused and don't know when or how to express them. For example, someone with this condition might struggle to express or understand that they are happy when something good happens to them. This doesn't just happen for good emotions, it can also happen for sad emotions. An example for that would be maybe something unfortunate happens to someone. They might not be able to process that they should feel sad. So in situations where some people should cry or might cry, that might not be something that a person with alexithymia would even think to do. This also is a reason why they have lower stress levels. For example, let's say you're failing a class. Most people would be freaked out if they failed a test, and then as a result are failing the class. They would be worried about their grade. They would be sad, probably scared. However, people with alexithymia, their stress levels would be lower because they wouldn't know how to express or maybe not know what the feeling of sadness is in that situation. Now, even though it is relatively new, about 10% of the world population has alexithymia. In more minor cases, it can be hard to accurately diagnose because if you're unable to accurately portray or identify your own emotions, you might not know that you are not feeling those emotions. This is another situation or another reason that it might be hard to diagnose is that it is only self-reported. We don't have the technology to understand or feel other people's emotions. Only the person who is feeling those emotions can describe them. So if someone doesn't know how to describe their emotions, it can be hard to diagnose that they don't know how to describe it. What are the various causes of alexithymia? Again, as I said, these aren't definitive causes. No one knows what the actual cause is, but these are just some factors believed to be related to it. First, we have physical factors, and we're going to look at genetic stuff first. So if you are a twin, you are more likely to have alexithymia. Same with if your family has a history of it. So if your blood relatives have it, there's a higher chance that you will have it as well. Males are 2 times as likely on average to have it than females. Also, age is another big impact. The older you get, the more likely you are. Next, instead of genetic factors, we're going to look at some physical factors that can happen later in life while you're living. Traumatic brain injury, especially in the anterior insula, which is believed to help regulate emotions. So as you can imagine, if the part of your brain that helps regulate emotions is damaged, you might not be able to regulate those emotions, feel those emotions, or vice versa. Then there's other disabilities. Alexithymia is very closely linked to other disabilities. However, it is also its own thing, which many people fail to understand. Next, we're going to look at some environmental factors. Economic status and education levels kind of go hand in hand because the lower someone's education level is, maybe their economic status is kind of closely linked or related to that. So the lower someone's education or economic status is, there's a highly increase of alexithymia. Second, we have environment. For example, prisoners who have been locked in solitary confinement for months at a time might experience alexithymia, as they are kind of deprived of some of the sensory things most people are able to experience in a normal environment. Finally, we have childhood development. For example, some people are raised to never show emotion. This is very common in men, and that's why males are more likely to have this, because in a lot of cultures, men are supposed to be stoic, manly, not really portray feelings as much as women are. So that can help. Also, if someone has trauma early in their childhood, it can throw off what their sense of emotion is. Next, we're going to look at the common linked conditions. Autism is our first one. About 50% of people with autism also have alexithymia. Now, this is a huge stage of contention, not that the 50% have it, but because a lot of people think alexithymia is just people with autism. So if someone has alexithymia but not autism, a lot of people will just stereotype them as autistic people. This is also considered the alexithymia hypothesis. And basically what this is many of alexithymia symptoms overlap with autism symptoms. And many people just think that because that is the thing, all alexithymia overlaps with autism. And while autism is included in the DSM, alexithymia is not. However, a lot of alexithymia's symptoms are part of the DSM classification for autism. Next, PTSD. About 40% of people with PTSD also have alexithymia. This one is weird because it does not correlate to the severity of trauma, but the severity of symptoms. So alexithymia is directly linked to whether someone might have more PTSD attacks or how severe those attacks are. And finally, we're going to look at depression. About 50% of people with depression also show symptoms of alexithymia. And we actually know a little bit more for depression. Alexithymia is considered to worsen symptoms of depression and could lead to increased phobias or psychosis, which is a lot of hallucinations. Now, these are just 3 of the most common ones, and there are a lot more disabilities that are linked with alexithymia. Next, if you have alexithymia, these are some possible coping options. Cognitive behavioral therapy, as well as psychotherapy, are often considered to be good, the best ways to treat it, as you can talk to someone, understand, or maybe help them understand what they are feeling. For example, say I can't feel sadness, or I'm having trouble conveying sadness. Someone who could help me, like a therapist, can help sit me down and tell me ways to describe how I'm feeling, or help me find ways to describe how I'm feeling. Some self-treatment methods are you can notice physical responses in your body. For example, if you are feeling angry or fearful, your heart rate might increase. And when that increasing heart rate, you'll be able to feel that in your body. And you can be like, why is my heart rate increasing? What might I be feeling to increase my heart rate? Second, you can record how other people react when they say they feel a certain way. So if someone's crying and I go up to them like, hey, what's wrong? They'll say, oh, I'm sad. That can help alexithymia people form the connection in their brain. Oh, when I see someone crying, that means they are sad. And next, it's important to focus on both positive and negative emotions. So while you're trying to find ways to express happiness, you should also be equally trying ways to express sadness. Because if you skew one way or the other, it could have possible outcomes. Finally, should alexithymia be considered a disability? I personally think it should be, and I'll explain why. But first, let me explain why it's currently not. Like I said, I'm going to repeat, it's relatively new. It was coined in 1970s, and that's only about 50 years. And when we look at the history of mental conditions and other disabilities, that's new in the terms of research and other things that are in the world. Next, I'm going to look at the alexithymia hypothesis again. Because it's commonly linked with autism and other disabilities, many people just automatically throw alexithymia into those disabilities and don't consider it its own thing. Finally, we're going to look at the legal definition of disability. Because it is not classified as in the DSM or recognized as a disability under the Americans with Disabilities Act, doctors can't really give away or diagnose it because it's not considered something to be diagnosed. Next, I'm going to look at a couple of reasons it should be. Definition of disability from the Merriam-Webster Dictionary is a physical, mental, cognitive, or developmental condition that impairs or interferes or limits a person's ability to engage in certain tasks or actions or participate in typical daily activities and interactions. I argue, and I think it's true, that if you can't understand your own emotions or you have trouble understanding other people's emotions, it is most definitely going to impact your interactions with people. It's going to impact your actions, and it's going to limit your way that you engage with other people throughout the day. Second, I think massively, the amount of people who have it. 1/10 of the world population experience alexithymia conditions. A lot of these come from people with other conditions, such as PTSD, autism, or depression. However, a lot of people who don't have those conditions also have alexithymia. As technology increases and we're able to better understand the brain and emotions and where those come from, I think we should definitely considering it a disability. Finally, what are people doing for advocacy? Again, I'm going to say it one more time because it's relatively new. Again, 1970s. A lot of advocacy is focused on teaching people. Not many people know about the condition, and they're just throwing it in with other disabilities like autism. Next, that's where I'm going next. Trying to separate from other conditions. This again goes back to the alexithymia hypothesis. Many people are just throwing the conditions in with other disabilities, which hurt both disabilities and their communities. For example, people with autism might not like being stereotyped in alexithymia conditions. For example, not all autistic people have trouble understanding other people's emotions. But because it's common and the crossover, many people just automatically assume that. Alright, thank you for watching and listening to my presentation.